I'm Stephanie Fanul, and I'm the president of the North Carolina Partnership for Children. What I see as the most critical issue right now for families and children in North Carolina is related to the economy, but it's not just the economy. It's our being able to communicate to the public in general that the investments in young children are absolutely essential for the future. It's our investment in those little kids, and everybody's embracing that idea that that investment is more important than anything else we do. So I think that now, when the economy is in the kind of trouble that it's in, there's a tendency for folks to do across-the-board cuts to programs or services instead of thinking very strategically about how critical it is for us to invest in taking care of very young children. You know, Smart Start is a big network. Smart Start is 78 local partnerships. And in each one of our local partnerships, there's staff, there's a board of directors, sometimes as many as 100 people who are actively involved every single day in providing services for young kids. And so Smart Start is the way we reach real people on the ground. The Smart Start local partnerships are the folks who establish what the needs are, who look and listen carefully to the community members to determine what really does need to be fixed. And they are also the folks who weave everything together. So in every local Smart Start partnership, what you have are folks thinking about new ways to do things that have so long been essential, and new partners to do it with, and new ways to make it faster or more efficient or broader or deeper. And so it's the partnerships in the local communities that are able to build an effort and provide the network to support young children. Smart Start started in North Carolina with Governor Jim Hunt back in 1993. And his concept was that the children showing up at kindergarten were not ready. And Governor Hunt had actually started statewide kindergarten, full-day kindergarten for young children in North Carolina. And so he understood how critical it was to get to work with children very early so that the architecture of their brain is such that they're really ready to just take on the world when they get to school. So what he did is had this concept that you had to go out into the local communities, and he built every single community had the opportunity, every county had the opportunity to compete for a Smart Start grant. And then we, over the course of years, rolled in every single one of the 100 counties in North Carolina as members of the Smart Start family. And then since then, we've been able to generate significant funds from the state legislature to support that effort. And it's from that platform that many of our programs for young children have grown, whether it's programs for health insurance or programs for the pre-kindergarten, or whether it's programs around education for early education teachers, or professional development or parent support. All of that grows out of the base that Smart Start local partnerships have established across the state.
Great. What are some of the challenges that Smart Start faces in accomplishing its goals?
I think when I think about our challenges as Smart Start, both at the state level and in the local partnerships, I think that our challenges around available funding are very real. We have tried to be as efficient as possible and have accomplished some incredible fiscal goals as far as our accountability. But the bottom line is that there's enormous growth in the population of 0 to 5, growth in the state in general, but even a bigger percentage in our very young children. And keeping up with what those children need and building the infrastructure to support them it actually takes real money. It's not something you can do on the fly. And so our challenge now is to be able to keep that steady during this period of time when the economy's in bad shape, and then get to the next place. And the next place is going to be very different for us. I think all of our skills around collaboration and cooperation all of our ability to see what a real problem is in a county or in a community, we're good at that. We are good on the ground. And so being ready when there are more funds available is part of what we're working on now. Trying to pare down to sort of right scale ourselves for this time, and then get ready for what the next moment it will be for young children. What I see Smart Start as being bigger and broader than it's ever been yet, but as big and as broad as the vision that Governor Hunt once put out there when he started thinking about a network of community-based organizations dedicated to the children 0 to 5. So that the kind of support, the kind of public attention, the kind of the depth of knowledge that we're able to communicate across the state is there for every child. And right now we're not serving every kid. We can't. And yet we know, anybody who's spent any time looking at the science around early development knows that those very first years will make such a huge difference to a child. And so Smart Start being able to keep that movement going forward so that every child in North Carolina gets everything that they need to get off to a good start. And that's the vision that I hold for us in the future. What I think that Smart Start needs from the community is what young children 0 to 5 need from the large public community. And that is a sense of how absolutely critical that investment is, which goes back to what I see as the biggest challenge facing us. There's been no question that is the most important investment for us to make. You know, I grew up in a family where we had some rough times, and I remember when my mother cut up the chicken pieces or cut up the chicken, and she fed everybody else before she took her share. And I know why she did that as a parent and as a grandparent. And as a community, as a state, we have to get there. We have to know that there will be moments where we will do without as adults or older people because we have to have these kids in the right place. And so balancing the state budget or cutting programs that speak to young children is just not a good idea. It totally flies in the face of all that we know around science. So that's what Smart Start needs. Smart Start needs everybody to remember that the kids from 0 to 5 are in fact the future for the state. Both the economic future for the state, they're the brain trust that's coming to the state. They're the ones who are going to create creative solutions to problems we have never thought possible to solve. And they are the workers that are going to go to work and hopefully pay our Social Security as the days go by. So Smart Start's what Smart Start needs is what young children need, and it is an overall understanding of how critical those first 5 years are. This last year has brought to Smart Start and to all the folks who care about early education and early childhood services a tremendous amount of hope coming from President Obama, who has focused at the federal level, both in the stimulus package and in his future budgets, on investing in very young children. So President Obama has added to the stimulus package dollars to expand services for families who are looking for childcare, for families who are in need of early Head Start, supporting the opportunity for professional development for people who work in early childhood. So his focus, his thinking that in fact, in order to have an economy come back, you have to pay attention to the young children. Just that intellectual framework is critical to the success of Smart Start and the well-being of our kids. And fact of the matter is, if you don't have childcare, you can't go back to work. And so being sure that the working families in North Carolina have really good care for their children that's available to them when the job shows up is a very important part of getting back on track after this economic downturn. North Carolina was really broke the mold when we started to build Smart Start. And in fact, in this office at the North Carolina Partnership for Children, we offer the National Technical Assistance Center, which is funded with Kellogg money to help other states build similar sorts of initiatives like Smart Start. And we've helped 11 states up to this point build their model based on our experience and our great success with Smart Start here in North Carolina. No, people talk a lot about the idea of a comprehensive model, but nobody's really been able to do that until we started to do it in Smart Start. And it's the weaving or the braiding together of both services and funding that makes it possible for a comprehensive approach to exist. And so we are nationally and internationally known as one of the first and certainly one of the best early education models anywhere. One of the programs that Smart Start's been able to really grow is the star-rated license here in North Carolina. And we were able to put that star-rated license in place back in 2000, where we decided it was important for parents to actually know what they were buying. And frankly, it's just like Zagat or the Michelin Guide. And so what happened was it was voluntary. And when we started, we had about 20% of the programs there's a 5-star range, and about 20% of them were at the 3-star, which was at that time the highest rating we had in the state. And in the course of time, so today, when we look across the state and count our 4- and 5-star centers, 56% of the children in child care in North Carolina are in 4- and 5-star centers, which is a phenomenal amount of children and a huge step towards what's really right for kids. Now the things that are and it's voluntary. So the child care providers have chosen to get more stars. They have chosen to improve their environments. They have chosen and invested in their staff, so their staff have higher education, have more experience, and are actually paid better. And so we get results from that. But going from 10% who were only 15% that were 3 stars, moving in 10 years to where we now have 56% of the kids in the 4- and 5-star centers is just an incredible success. And we did it in that Smart Start way by weaving and collaborating with local communities and putting money in that came from the feds, money that came from the state, Smart Start money, and any other funds that local communities could put together to make quality child care available across North Carolina. It's a big win for us. One of our big challenges, though, that lives still in this system for early education, particularly in the child care arena, is the lack of good quality care for infants and toddlers. Our infants and toddlers are not getting the care that they need, partly because it's so desperately expensive, and partly because we just can't keep the supply going so that it turns into something families can afford and centers can afford to provide. And so we have a disconnect now. And good news, back to President Obama, the good news with President Obama's proposal in the stimulus package is to invest in expanding infant and toddler slots. And by doing that, we hope we'll be able to do a little bit better on serving our babies and toddlers, because they need the care and their parents need to be able to go back to work.
So it's just an expense or a resource question with that?
It's actually both. Because it really is very intensive care. You can't have a lot of children in 4- and 5-star centers. It's 3 and 4 infants per teacher, and that's what it takes to do that work. And so if you're going to do that, that means that you have to have enough. You have to charge enough as a provider to be able to pay your staff when you only have 4 units, if you will, 4 children or babies paying for that teacher. And that makes it very expensive. In some of our counties, Wake, for example, it's well in excess of $1,000 a month to care for an infant in a 4- and 5-star center. So for a young family with infants, that's a pretty significant portion of their income. So you'd have to be making significant money to be able to buy that service. And since that's hard for families, then there are fewer slots available, since you can't fill your slots as a provider and make a living at the same time. So we're caught in an unfortunate bind, and we haven't been able to expand the services for infants and toddlers in the same way we've been able to expand our services, for instance, for 4-year-olds.